Good morning. Thank you so much for joining. This is our first ever and hopefully annual webinar on pediatric oral health care. I'm Jeff Miller. I'm the President Integrated Care for Western Dental and Orthodontics. We're one of the largest dental providers in California and the largest in the Medi-Cal dental program. Our mission is helping to expand access and equity to oral health care. Some of the most traditionally underserved communities in the state. We understand firsthand that early access to dental care for kids is so important, and we're so excited to have the folks here. I want to first of all thank you for joining us, Eileen Espejo from Children Now, Kathleen King from Healthier Kids Foundation, and Bracho from Latino Health Access. Your collaboration and insights have really been invaluable on this important topic and frankly sometimes overlooked topic. The importance of oral health for kids and the continued efforts to expand access and equity of dental care drives not only better health outcomes, but frankly better educational outcomes as well. So if I can take a moment before we begin our discussion, I'm unbelievably pleased to introduce Assembly Member Dr. Joaquin Arambula from California's 31st District, located in the Central Valley. I'm particularly pleased because Dr. Arambula, we've worked with you for years. You've been a champion for oral health care and Medi-Cal in the state. As a former emergency room doctor, I think few in the state's capital have the kind of firsthand experience that you do in promoting whole person health. Your work in Sacramento has focused on a number of things, but particularly on ensuring that healthcare is available for all Californians as a fundamental human right. And we're aligned here at Western Dental with that mission to make oral healthcare accessible and equitable. And it makes us really proud to have you deliver our opening remarks. So with that, let me hand it over to you.
Thank you so much for that warm introduction, and it's a pleasure to join you here today on this webinar. For those that don't know me, I'm Assemblymember Dr. Joaquin Arambula, and I was an emergency room physician and still have my license active. But in my practice, where I saw 50,000 patients firsthand, I witnessed both the best and the worst that can happen in our healthcare system. I've seen what happens when our patients cannot obtain the health care that we know would restore their well-being, which would spare them financial hardship and which would allow them to live with dignity. I saw the injustice that happened firsthand when our vulnerable members of our immigrant community are unable to access health care in preventative manners and oftentimes are seeking care through an emergency department where they would see me. It allowed me to see that injustice and to become and run for office where I could then champion health for all. I'm grateful that we're here in the great state of California, where we have made expansions towards our undocumented community, including all kids, now all young adults, and as of May this year, our elders and seniors. This is the largest healthcare expansion we've done in our nation since the Affordable Care Act has passed, and I look forward to full implementation and the work that goes on ahead. My passion for healthcare issues like rebuilding and maintaining the great California healthcare workforce has been going on for many years. As the first Latino physician, I focus on how health equity for our underserved communities remains a topic in our state capital, and I have championed many of the transition that we've been making within Cal AIM, as well as whole person care, as it's something that I've seen firsthand, that we can't create silos. We have to figure out how to wrap our arms around the community members who so desperately need services. That equitable access to high quality healthcare services, such as dental care, is important to the health and prosperity of our state and to the future of every Californian who needs or delivers great healthcare. Oral health is oftentimes overlooked or postponed by patients themselves who need it, as well as those in the state that provide Medi-Cal services for more than half of California's children. What we do as policymakers and what we do as care providers will have lasting impacts on the overall health and lifespan. And there's a lot riding on us for us to get this right. California has instituted both Prop 56 and Cal-AIM. We've made progress in expanding access and equity of care to more people, particularly for our underserved communities. And while we are making these advances, we also must transition to whole person care, assessing the social determinants of health, making sure that we get a comprehensive history and addressing the barriers to healthcare access that so many in our community are facing. We have a great panel here today who will go into a deep dive on this very topic and highlight what dental care can do to be a critical and important part of health equity in the conversation for our state. I'm grateful for the invitation to give you this welcome today. Look forward to the discussion, and thank you again for the invite.
Dr. Luther, I'll hand it over to you.
Thank you, Dr. Arambula, for those opening remarks, and we really appreciate you coming today. I think you framed up the discussion very well. We all know how important pediatric oral health care is, the importance of pediatric care to overall health, and even to mental health and education. We're here today not only to talk about pediatric oral health, but also some of the barriers to care that our communities are receiving, and also some of the key issues that you face in your organization. Before we get started, I'd like to tell those that have questions to use the Q&A function at the bottom of your screen. And if we have time at the end of our panel, we will address those questions. So thank you for that. I'd like to start today with our panelists asking you how and why your organizations have prioritized oral health and equity as part of your work. America, let's start with you.
Thank you so much. Good morning, and very honored to be part of this panel. Latino of Access, the organization that I have the privilege to direct, works with community health workers in low-income areas with mainly immigrant communities. And we do our best to address the issues of inequities. And we see so many barriers to access to healthcare, barriers that are connected to a zillion things. I mean, it's not just the individual barrier, but the systemic barriers. Our community workers live in the communities we serve. So this is not about these issues affecting others. This is these issues affecting us in those same neighborhoods. And they work with families and see these issues affecting them, how they prioritize oral health when they have to prioritize so many things. How can they prioritize access to oral health when sometimes they don't even have time to leave work, or to pay attention, or to be informed, or to understand well the consequences of not preventing these conditions. So Latino Health Access is doing its best to talk about these issues and support people with navigation, and to also explain to them the benefits. Sometimes people don't understand the benefits. And sometimes the issue is that they don't have providers in their area. So it becomes then a waste of time, and then people have really so many priorities. So our main work is to find them, reach them, inform them, support the navigation, and do education. We actually partner with Western Dental to do a lot of education there, and then to do the advocacy that is needed to improve access and care.
Thank you very much for your comments. Eileen, can you expand on what your organization is doing?
Sure. Thank you again for the opportunity to participate today. It's incredibly important to children now as a whole child organization to prioritize oral health for kids. We all know that oral health is part of overall health, yet historically and currently, and I like to believe unintentionally, but that will change soon, There have been systemic challenges that end up separating everything above the neck, as if our mouths and minds do not matter. These matter to a child who needs to eat, learn, and grow into the healthy and thriving adults we need them to be. So oral health is one of the several issues that Children Now works on in order to ensure that every child in California reaches their full potential. And Children Now does our work in a variety of ways, primarily through policy advocacy, primarily through working with all of the counties that have local oral health programs that have developed and are implementing county oral health strategic plans, providing them with technical assistance, letting them know the current regulations and laws that do exist, involving oral health coalitions and community-based organizations to understand that they also have a role to play to help educate and inform policymakers on what's working or what's not working, to identify bright spots, such as and including the Health Plan of San Mateo pilot that I know Western Dental is involved in, to see if that's a scalable model that we need to bring to other parts of the state. To share data between medical and dental providers, Children Now has helped to establish pilots in Los Angeles County as well as in Sacramento County, now expanding to San Joaquin County, counties that are using technology in order to share data between medical and dental providers and to figure out that referral loop so that there's the closed referral loop, that a provider will actually know that, that a child did go to the dentist after a community health worker, care coordinator has helped facilitate that. So really admire the work and the really important work that Latino Health Access is doing to close that loop. So a lot of our work has to do with just educating and informing across the board. Parents, children, of course, families, policymakers for sure, community-based organizations, county health departments, providers up and down the board. We all have a desired result to keep children healthy. And so it's all going to take our collective efforts in order to make this happen. Thank you again.
Thank you, Eileen. Kathleen, last but not least, I'll pick on you next.
I like to be picked on. Thank you. So Health Your Kids Foundation has the claim that we were the first county in California to have a program for undocumented for health insurance. And what we found out is if you have insurance for undocumented, you have no wrong door. So we went from 1 out of every 6 children not having insurance to 98% having insurance. And then all children were pretty much given an opportunity to go into Medicaid, Medi-Cal. So we decided then that the issue was that a lot of people didn't know how to use their insurance, especially the underserved. And we started out with going into schools and doing their vision and hearing screening. And I decided that dental was just as critical as vision and hearing. And now I will say it's more critical than vision and hearing. And so we screen about 25,000 children a year in underserved schools. And if a school wants our vision and hearing, they are required to take our dental in TKK, 2nd, 5th, 8th, and 10th. And our real effort is not so much around the screening with licensed dentists, but we have a group called Parent Advocates that are bilingual from the community who speak with every parent whose child gets a referral, because we know how that goes. The paper goes in the backpack and is lost. So we have success rate on over about 65% of those that get a referral. And the issue right now is about over 40% of the children are getting a referral for emergency urgent care for dental. And we estimate about 2,000 children in Santa Clara County go to school with a toothache, just to put it in perspective. Thanks, Dr. Luther.
Thank you very much. Western Dental takes access to care very seriously. And also, I want to talk a little bit about what provider organizations can do to confront barriers to care. One of those is to make sure that the staff is culturally competent, ensuring that at least some of the staff are bilingual. Some of our patients need financing, for example, in order to obtain care. So there are many things we can do in our provider organizations. One of the keys is health literacy techniques, using the teach back method to ensure that the patients we have really understand what their options are for healthcare, that they're not embarrassed when they try to obtain the care they need, especially for those that are second language learners. America, I'm going to pick on you once more and talked a little bit about access and barriers. I'd like to know take a little deeper dive into what your organization is doing around expanding access. And then also the other day in our conversation, you mentioned that there are things that you feel are working and things that are not working. I'd like you to expand on that just a little bit.
Sure. When we work in such a close contact with communities, we learn things very fast, and we have to stop judging. Maybe that's why I selected public health, because I hate judging people. I think that you have to walk in their shoes for 1 minute to really understand what's going on. There is and I'm going to try to be brief, but mention a few things. In order for you to make a decision, you need to understand, you need that knowledge, but you also need to feel vulnerable, and you need to see this issue as a priority. And there are many things that will help with that behavior. So low-income communities are impacted in all of them. And the lack of knowledge, and sometimes, you feel vulnerable to a level, but you also as an adult do not have access. So it's almost like every children in town need to have cavities. That's part of, growing up. So this sense of vulnerability is different when you have to just decide if you do this or this, who cares? And if we have a cavity, then we can go to an emergency room, which the emergency room will not take care of the treatment of the cavity, but at least of the pain. So you delay treatment. And that happens not only on oral health, but other things. Then it's easy to just blame that person. Oh, they should be more informed. They should understand that kids are going to lose, to miss hours of class. But what we need to also understand is that there is a system that is not very friendly. Again, mentioning what you said, sometimes it's the provider, but sometimes it's just that we don't understand those benefits. Medicaid or Medi-Cal, might be just a doctor that can see my kid when I need it, and I don't understand the rest. So we don't talk about helping people. We talk about providing a company and a navigation that is compassionate to people to make it effective, and also learning, because there are many things that providers don't know. We don't know, and if we don't know, we cannot help. So, but for example, I'm talking about Orange County, Latino Health Access, but I have participated of larger work task force in the state, and in the nation, there are 68 million people that live in places where there is dental shortage. Really, this is a dramatic systemic problem that we have. We have dentists that do not receive Medicaid. So people think, okay, I have a dentist close by, but it happens that he or she doesn't receive. So not only we need to try to assess and match where you can go, but also we have to pay attention to the adults, to the parents. And these parents do not qualify for dental care. So we also need to link them with community clinics that provide dental care. So there are, then the school, and Kathleen is an expert on this, but we have so many missing opportunities of places where kids go and the providers do not pay attention to that referral, to that connection, schools, pediatrician, et cetera, et cetera. So there are systemic gaps that we need to pay attention for sure.
Thank you for those comments. Dr. Arambula, I want to thank you once again for your opening remarks. We really appreciate you coming on. For those of you just joining, thank you for entering our discussion. And again, we appreciate your input. So, Kathleen, we talked about the importance of access. What we haven't really touched on is education at this point. We know how important oral health is to education, that some 2 million days of school are lost every year for children between the ages of 5 and 17 because of dental issues. I also noticed in looking through some of your materials that you have put together some very good educational materials, such as Miguel the Crocodile, which I really enjoyed reviewing before for this call. So could you just touch on the importance of education and communication with children around oral health?
Thank you, Dr. Luther. And America's right. It's parents have so many decisions to make. And what we've found is children really don't even want to tell their parents if they're suffering from a toothache, because they know their parents are working many, many hours and it would take away from their time. So the idea that I think it's a great idea that we get children to their pediatricians, but where do we know they spend a lot of their waking hours? In schools. And so the idea that we don't dental screen in schools keeps me often awake at night, just thinking about, we do almost every other grade in the underserved schools we go into, but it should be every grade. So, and we're data fanatics. We've offered about 483,000 services now. I could pull every one of them and the report on every one of those going back 9 years. And the issue is just getting those children into their care. We do 3-way phone calling. We've had Saturday clinics with Western Dental. I do have to say, one of my best friends is Edwin, and I can just call him, and Edwin's like me. We're passionate about just like everybody on here. But to think that the best place we can get children, I think, is at school. And the health of the child, we did a study just before the pandemic. We have a data zone that keeps track of absenteeism and chronic absenteeism. And for those children we screened who didn't get dental care, the percentage that missed more than 3.5 weeks a year doubled. So we know that 2 million days missed is not only just the child, but the parent as well. So not taking advantage of the school system. If I could advocate here, I think Eileen, America, and Dr. Luther, we need to be advocating to have dental screenings at schools with dentists. Thank you.
Thank you for those remarks. So Eileen, I'm going to ask you to talk about a subject that is talked about a little less, and that's the connection between pediatric oral health and mental health and well-being. Can you address that connection for us?
Yeah, I'll just pick up on what Kathleen was saying earlier about schools. You know, if a child can't concentrate on a lesson because they're suffering from a toothache, it goes without saying that this child is probably also suffering from poor nutrition and possibly self-esteem issues as well, or just the ability to communicate clearly what their needs are. So it makes it that much more difficult for them to learn, stay, and concentrate in school. So kind of making that link between, again, overall oral health, and also just the ability to stay in school. So those counties that have school-based or school-linked programs that can help to screen and refer to oral health services can really help close those disparity gaps and possibly even screen for maybe some mental health issues that that child may also need access to, right? If you're going to see a child that you can see is clearly suffering in other ways, I don't believe anyone's going to just stop at saying, well, we ticked off the oral health issue, so that child's good. We have to see this child as a whole person. So there likely are other either nutritional or mental health issues that can also be addressed, again, either through a school nurse, if a county or school is so lucky to have a school nurse on hand, or through school-based, school-linked programs, school-based health centers, all to make it just that much easier for a parent who can't take that time off from work, who might need more transportation in order to access any and all of these health services. And that's why I do think that the program that was just passed to get communities and schools to bring services to schools is so important. And so those schools that have these grants that are trying to build up the infrastructure to really make the school as a place where it's a one-stop shop to get access to all services is it's critical to help even with the CalAIM implementation, right? Like that local educational agencies need to be partnering with the Medi-Cal managed care plans to help with CalAIM implementation. To really innovate and advance Medi-Cal is going to be to bring the services to where children and families are. Because coverage is one thing, access is a whole other issue.
So our panel's done a really great job of framing up not only the importance of pediatric health to overall health, to education and mental health, but I'd like to step away from that just for a minute and talk about what are the things we can do to advocate better. And America, I'd like to start with you, and then the other two panelists, just feel free to jump in. I know Kathleen already discussed that in terms of education.
I'm going to start with finding the families. I think that it is crucial that we find them, that we can communicate all of these blessings of prevention, and also engage them in the advocacy, because this is nothing about us without us, correct? And people need to advocate for having these services in their communities or close by, because if they don't have transportation, they don't have money, and it's not going to happen. So I think that communities need to join. Community health workers and the inclusion of them in our practice is crucial. Community health workers can be engaged in the dental practice as well. And right now, through CalAIM, there are many opportunities, not only of having community health workers, but being reimbursed for the work of community health workers. So I think that people need to find out more how they can bring community workers. We certainly can be of help to support. There are many organizations that will be working on training, on engagement. So I think that community engagement is crucial, and community workers are the ones that can do it. Community workers also have been identified as the workforce that can truly improve equity, because they work and they address all of these social determinants. That will be one. The other one doesn't come from my brain, but it comes from the Pew Charitable Trust, where they recommend to expand the dental health workforce to include these dental experts that act as physician assistants, and that they are trained to do things. Their scope of work is larger, and they can be deployed in other areas where there is shortage. And also to expand the work of the current dental providers that are not dentists to work at school, for example. So we can have programs that operate there and do not require dentists all the time. So I think we need to be creative and go out of the traditional models like we used to do with physicians. Only physicians can do this. And then nurses, then nurse practitioners, then physician assistant, and promotores, and medical assistant. I mean, it is extremely important that we move from that ego position in which we are the only ones that can do things, and we keep that like tight. And when we can be creative, train others, include others, again, including community workers.
Thank you for those comments. I think we can all do more to expand access and equity, and really think outside the box in the things that we do to accomplish that. What more do you think the state can do? This is for the whole group, to really be sure that oral health is included as initiatives are expanded.
I'll jump in quickly and try to be succinct, but Assemblymember Dr. Joaquin Arambula had mentioned Proposition 56. That was the tobacco tax dollars that we've received to not only incentivize providers, of course, to perform certain services, but it also helped to fund the local health departments that have created and implemented and are putting into action their county oral health strategic plans. We're going to need continued funding Proposition 56 is working in the fact that revenues for tobacco products are going down. So we're going to need some kind of continued investment to allow for county health departments and the partners that they have partnered with, being providers and community-based organizations, to continue that work. It's critically important. They just started their second year of a 5-year cycle this fiscal year. We also need to determine sustainable incentives to recruit and retain providers to serve in the underserved communities through continued loan forgiveness and other programs. And to America's point, we need to maximize that recently implemented community health worker benefit. That's a game changer, and we need to see that in action. So it went into effect in July. We know that there are several groups that say, you know, that they have the promotores, they have the navigators, and they just need to figure out, like, how is the Medi-Cal managed care plan integrating us into their workforce so that we can actually reimburse and serve the many members who can benefit from having someone help them navigate the system. So all of those things, I mean, it's going to take more financial resources. And to America's point, that's going to require all of us in order to advocate for those resources and to advocate for these resources to be prioritized. And that happens through policymakers, through the budget process that'll be kicking off again in January, through educating community-based organizations and family members and policymakers, again, to really make sure that oral health stays at the top of the agenda.
Great. So Kathleen talked a little bit about some of the resources that she's providing around education, going out to the community. For America and Eileen, what resources are you providing to parents and children to educate, to improve the importance of oral health within your organizations?
Dr. Luther, can I just, there's a Q&A question asking if people will get the recording. I thought maybe we could just answer that. I'm sure they're going to be able, if they're on this, to get a copy of the recording.
Yes, they are.
Is that okay?
Yes.
Thanks. Just like to answer that one. Well, I'm going to say something here, Dr. Luther.
Okay.
Because I am as about as frustrated as I can be in everything with the state. So community health workers.
Yes.
As far as I can read, they've made it so complicated that it would cost me more to do it. I thought America would agree with me. It'll cost me more to do it than to utilize the funds. So frustrating. We do everything we do by philanthropy. That's frustrating. Our dental referral rate was working its way down. We had gotten down towards 30% referral before the pandemic. We'd done a study that 93% of those that we helped, we did a survey with them, and they were continuing their dental care within the next year. Very happy about that. Pandemic comes, we start going back last year, screened over 20,000, and our rate jumped 33%, 40%, and in some schools, 50% of the children have severe cavities. It's our state is not spending enough in this area, and we love our partnership with Western Dental, but the state is not spending enough with children on dental. So I'll get off my soapbox now. Thanks.
So I think part of what you're saying is screening is fine, but then we need the tools to ensure that those referrals get in the right hands into provider groups that can see the children and service their needs.
So I think that here we have a very good problem. In part of this conversation, we have a good problem. Half of the kids that qualify for dental care services do not use those services. Half of the kids in Medicaid, Medi-Cal do not use the services. And that is a good problem because they have coverage. Now, the thing here is, what do we do with that? And this is the issue of inequity, you know, which is an area in which we work a lot, and you were asking about that. having the service is not enough. There are so many barriers that make that proposition inequitable. So in order for them to use that, there are so many things. I was sharing in that place, Jeffrey, that in that gala that you attended, that that you can have this service. We saw this with COVID. In order to help a person get a vaccine, we had to provide 15 services, from translation to completing a form, to assuring transportation, to having the education, to get the text, to set up an email account, because there are so many inequities in our communities. So having the service, having that vaccine, didn't mean that people will just access. And for other people that had insurance and knew how to access, there was 0 minute in navigation. So with dental care is the same. The kids have this. I mean, we have Western Dental that take Medicaid, thank goodness. And we need more of that. We need more of those partnerships, but then we need to somehow move the needle in how we navigate with them. Navigation is crucial. But then, like Kathleen was saying, we have the option of community health workers now, which is a good problem. Not having enough reimbursement is a good problem, because at least now it is allowed. So now it's a matter of us advocating again to have decent reimbursement and the consideration that we have administration expenses. I mean, otherwise these are going to be proposals or options that people cannot use. And that is when it takes that ongoing advocacy. I mean, not to just give up. We have the right of having oral care in our communities. Then healthcare, like the World Health Organization says, healthcare is a right and it's an obligation. And that's why for us it's so important that the voice of the parents are in the mix. So when we do this advocacy, it's not just Kathleen, it's not just Eileen, it's not just America or Jeffrey. It is a community that is asking for more reasonable, equitable practices.
So America, I totally agree with you. For those of us that work with dental benefits, we make the assumption that everybody is aware of those benefits and can access them. And your point is very well taken, that is not the case. I'm going to turn now to Jeff Miller. He's been sitting quietly, and that's really not like him during this entire panel discussion. So I'd like a few words from you, Jeff. Anything we've missed, or
yeah, sure. No, that's
you'd like to cover?
Yeah, thank you for throwing it over to me. I do think you're right that we take for granted. One of the things I think that we learned as Medi-Cal expanded its dental program is we were astounded that the beneficiaries didn't know that they had dental as a benefit. And this has lasted for a while. For adults, the coverage was reinstated in 2014. And children have had it continuously, although the population has expanded, but they don't know that they have the benefit. So even before, and you're absolutely right, America, and you were so poignant a few weeks ago about it, that for us, there's one step, which is I need to call and make my appointment, and then we're there. For other, folks in many of the communities that we're in, it's 12, 13, 14, 15 steps. And then we were surprised that there's this drop-off rate of who actually utilizes the benefit. I mean, we've tried to focus a bit more than others on outreach and education. But one common theme from you guys that's clear is the amount of collaboration that's needed. I in my mind, I'm thinking, okay, well, what do we do as we move on with other discussions around this? And I think you've mentioned a few times, the Medicaid managed care plans have such a critical role to play here. That we have this bizarre, state program where you have this Medicaid managed care program on the physical health side, and then it's mostly a fee-for-service system with just providers on the dental side. Arguably, behavioral health, we don't really know where that's fit in, and that's kind of where CalAIM has come. And so we need to figure out how we can sort of unify those things, because ultimately, that's the only way you get whole person care is if all that's working together. So it's great to have voices like yours, because I know you guys hold everybody accountable. And then the one last thing I would mention is that we do have a state oral health plan, and Dr. Jay Kumar, who was basically recruited here, has put that together. As we've talked to him over the years, I think his focus is on, listen, the local counties, they have a lot of resources and responsibility here. So, it's not going to look exactly the same in every, corner of the state. But I think that this is great. It's a great discussion on how we can collaborate, and it's maybe not one size fits all, but how do we collaborate in one place, one community, and kind of move the needle.
Thank you. This has been a really rich discussion, and we do have a little time left. So what I'm going to do now is read a couple of questions from the audience for the panel, and we can throw those out. The first one is from Guadalupe Mosqueda from El Concilio in Stockton. And her comment is, I think that another factor that goes into the equation is the fear that children and parents have when going to the dentist. And this goes back to the education, and that's the question. And I think this is a very important point. There are a lot of misconceptions around pediatric oral health, getting children in early, the importance of saving young children's teeth as the second teeth come in. So could you address this fear component that both parents and children have, and how we deal with that in education?
So I can address some of that. If English is your second language, it's nice if somebody talks to you about it in your native language. We found that helps. We, as you know, created books around dental care. We talked to the parents, usually individually, and then as we went to the schools and said, we will do your vision and hearing if you take our dental, we came back and said, we will do your vision, hearing, and dental if you take our oral education. So we have about 10 to 11,000 participants in our oral education as well, because there are many parents that don't understand the value of baby teeth, I believe. It's you don't learn that. One of our funding from our public health through Dr. Kumar is to work with pregnant persons and try and get them in for dental care before the baby's born. Because really, if I had it to start all over again, that's where I would have started, is let's get to those that are having children and help them understand how important dental is. So I hope that helps.
Yeah,
and we're very willing to share our dental book. America has.
So Kathleen,
Okay,
pulling out from your publication, Miguel the Crocodile, a very simple thing that parents can do is keep the conversation positive with their young children. You don't say, oh, gee, this is going to be a bad experience going to the dentist. I'm going to buy you a toy and drag you in. It's better to have a positive discussion. Say, this is really great. You're going to enjoy going there. You're going to meet the friendly dentist and staff and so forth and so on. So some of it is really about the way the conversation is set up with parents. Eileen, the next question is for you. Can you talk a little bit more about your efforts to better integrate oral health into primary care for kids?
Sure. Thanks for that question. So back in, I want to say 2015-16, we did a pilot in partnership with Department of Healthcare Services, the dental managed care plans, the fee-for-service fiscal intermediary. So that was Delta Dental at the time. There were American Academy of Pediatrics, CCLA, you name it. We had everybody around the table to talk about what is it going to take for sharing data with pediatricians of children enrolled in Medi-Cal who are ages 0 to 5, so that that pediatrician, that medical office knows who's assigned to them who hasn't had a dental visit. So this is based on claims data. So we we're able to share that data with these primary care physicians, and we train them to say, hey, if you have a child that's flagged that hasn't had a dental visit, here are some resources. Here's a prescription pad form. Here are some dental providers that accept Medi-Cal that you can refer these parents to, because that was the #1 fear from the pediatricians. They were like, not going to make an empty referral, right? They were like, what's the point? So we made sure, we worked with California Dental Association. We made sure that there were providers that were willing to take those kids. And we found that within 6 months of a child going to their pediatrician, because they do see the pediatrician more than they happen to with a dentist, within 6 months, the 40% shot up of the children 0 to 5 who actually had an eventual dental claim that was filed. And so we know it can work. We know that other counties have taken that model to get electronic about it, which is fantastic. We know that counties are working towards creating that infrastructure. And we know that they're integrating what they call them care coordinators, teeth coordinators, to make sure that those teeth coordinators can see what is it that's preventing that parent or family from bringing their child to the dentist. Is it transportation issues? Is it the hours that provider is available? Is it the languages that are spoken or not spoken? So we've seen that applied also in Sonoma County, where they have been training OBGYNs to see who of their pregnant individuals have not had a dental visit, using that as a point of oral health education. So the onus isn't always coming just on the parents and the caregivers. It's really about, again, if you care about the overall health of the individual who's before you, it does require a village. It's going to require medical providers to know. It's going to require, some dental providers don't take people who are pregnant too, right? So we got to break through a whole bunch of different myths on a whole bunch of different sides in order to just make it easy and comfortable for a parent to say, we're going to the dentist today. It's no big deal. It's just, this is a normal thing that we should expect and not something scary or to have fear over.
Yeah, and more needs to be done to really integrate dentistry into the health system, to get all providers working together for the common good of solving these very, very difficult problems. The next question is from my good friend, Dr. Olinger in San Diego. Oh no, this question is for me. So I'm put on the spot, maybe Jeff as well. His question is, does Western Dental have the capacity to appoint Medi-Cal patients, particularly children, and complete their treatment plans in a timely manner? And does Western Dental prioritize preventive services such as fluoride varnish and sealants? The answer to your question is yes. Western Dental overall has the capacity to, and is really built on providing services for Denti-Cal patients. And also all the offices provide services to children. We also have many offices specifically tailored to children's dentistry. And of course, the foundation of those offices is to provide preventive services such as fluoride varnish and also anticipatory guidance to parents and nutritional guidance and those things. So are there any more questions? Other than that, I think I can give closing remarks. It's been extremely worthwhile to have this discussion. I'm very thankful to Dr. Arambula and the panelists for this not only discussion about pediatric oral health, but also solutions that can drive success in this area. I look forward to further discussion on this topic, and certainly we've just touched on many of the issues that barriers to care, better communication to parents, what we as our organizations, provider groups, and the state can do to improve pediatric oral health in our communities. And I also would love to thank all the participants on this call. I know we couldn't get to all of the questions, but thank you so much for your interest, and we look forward to further discussion. Bye-bye.